Hello, this is Debu Tripathy, Editor-in-Chief of Cure magazine. I'm at the San Antonio Breast Cancer Symposium, and I'm reporting to you about two studies that are looking at hormonal therapy, a very important treatment that has been used for over 40 years in breast cancer. Estrogen seems to drive breast cancer growth. Not all of them, about 60 to 70% of cancers are what we call hormone-sensitive. That is, they express the hormone receptor. We believe that their cause is somehow related to estrogen, but by blocking it, we can also treat them. Hormone therapy is commonly used to lower the risk of breast cancer, and it cuts the risk in half. It cuts the death rate by a third, and there's still some questions as to how to best use it. About a third of patients that are diagnosed around the world are pre-menopausal, and that means that the hormone therapy we use for them is tamoxifen. This has been the standard of care for these patients for a very long time. But even before that, one of the treatments that was used was taking away the source of estrogen, the ovaries, and that also had an effect. So the big question is, does shutting the ovaries down, either by surgically removing them or using drugs that are injected every month that shut the ovaries down, does that add to tamoxifen? Should we be combining the two? This question has been around for a very long time. We've never quite answered it, and there were two trials that were merged together called the TEXT and SOFT trials. These were run internationally, and it's taken about 10 years to get all the follow-up information. We finally have the results, and interestingly, it doesn't really add much to shut the ovaries down, which is good news because it does cause more side effects. Now, there were some caveats in sub-analyzing the data. For example, patients who were under the age of 35 did seem to get a benefit, and so for them, I think it is something that is important to discuss. The other category of patients that seemed to benefit were the ones that were at high enough risk to need chemotherapy in addition to hormone therapy, particularly the ones whose periods didn't go away with chemotherapy, which is a side effect. If you keep having your periods, we've known for many years that your risk is higher. Those patients, when their ovaries are suppressed, did do better. So this is an important conversation for patients to have when they are completing their therapy, if their tumor is hormone sensitive and they're going to be getting hormonal therapy, and they're premenopausal. They're still having their periods. An important thing to go over because for some patients this may help.